In this session of MSD 017, Challenges to Sustainable Development, we are going to learn about water, sanitation and health, achieving universal health coverage. WASH is an acronym that stands for Interrelated Areas of Water, Sanitation and Hygiene. WASH strategy has been developed by World Health Organization in response to Member State Resolution and 2030 Agenda for Sustainable Development. Sustainable Development Goal 3, that is Good Health and Well-being, and Sustainable Health Goal 6, that is Clean Water and Sanitation. It is component of WHO's 13th General Program for the work for period between 2019 to 2013, which aims to contribute to the health of 3 billion through multi-sectoral actions like better emergency preparedness and 1 billion with universal health coverage. Let us understand the backdrop and details of water, sanitation and health and universal health coverage. In 2010, the UN General Assembly recognized human right for access to water and sanitation. Everyone has a right for sufficient, continuous, safe, acceptable, physically accessible and affordable water for personal and domestic use. UN Millennium Development Goal had a target to reduce half the proportion of people without access to basic sanitation by 2015. Safe and readily available water is important for public health, whether it is used for drinking purpose, domestic purpose, food production, recreation purposes. So the improved water supply and sanitation and better management of water resources can boost countries' economic growth and contribute greatly to the poverty reduction. So overall, gaining access to drinking water and sanitation is key for disease prevention. According to a survey by World Health Organization in 2015, 2.5 billion people lack access to improved sanitation. 748 million people, they lack access to improved source of drinking water. 1 billion people, they practice open defecation. Open defecation has many socio-ecological impacts as it compromises common pool resources like soil, waterways and groundwater. 9 of the 10 people, they live in the rural area, but slowly, number of in urban area is increasing tremendously. Half the country did not report on access to adequate sanitation in school or healthcare facility. This suggests a lack of monitoring system and capacity. About 34% of primary schools and 25% of rural healthcare centers, they lack improved sanitation facilities. According to United Nations Joint Monitoring Program 2017, the target set for Millennium Development Goal for the access of safe drinking water were met in 2010. That is 5 years before the deadline. So the progress made over the course of Millennium Development Goal was quite impressive. Between 1990 to 2015, 2.6 billion people gained access to improved water sources. About 2.1 billion people gained access to improved sanitation. The number of people practicing open defecation has gone down to nearly 50% since 1990. In 2015, United Nations established Sustainable Development Goals, which are a set of 17 global targets designed to promote present and future prosperity for everyone by 2030. These Sustainable Development Goals, also known as Global Goals, are now complementing and improving on the goals initially outlined under the Millennium Development Goals. Among these 17 goals, SDG 6 addresses the issue of water scarcity, appropriate use of water resources, improvement of human health by enabling local participation in water, sanitation, and hygiene, which is the wash management. These goals challenge all the countries to ensure universal access to water, ensuring the health and well-being, and also achieving access to adequate and equitable sanitation and hygiene for all. It also has a target to end the open defecation by 2030 while paying special attention to the needs of women, girls, and those in the vulnerable situation. Sustainable Development Goals include behavioral and infrastructural target for sanitation, which requires 892 million people switching from open defecation to latrine use, and 2.3 billion people gaining access to a private latrine. Achieving SDG 6 targets in indigenous and vulnerable population is, however, challenging task, considering the historical and ongoing colonial practices, social exclusion, climate and environmental changes, and geographical isolation. According to latest report by WHO and UNICEF in 2019, still globally 1 in 3 people, that is 2.2 billion people, still lack access to safely managed drinking water services. Around 4.2 billion people lack safely managed sanitation services. Unsafe hygiene practices are widespread and it is compounding the effects on the people health. Impact on child mortality rate is devastating, with the more than 297,000 children under the age of 5 who die annually from the diarrheal disease. Open defecation and lack of safe sanitation are associated with the increased diarrhea and mortality, and it also has a negative social impact among the women and children. Diarrheal disease alone is responsible for death of 1.5 million people every year. In India, nearly 1 lakh deaths of children under the 5 years are mainly due to diarrhea and other waterborne diseases. It is estimated that 58% of diarrheal disease are attributed to unsafe water supply, sanitation, and hygiene. Risk of spreading diarrheal and waterborne disease is compounded by lack of regular hand washing and microbial contamination of water in homes as well as in the community. Let us understand about sanitation. The word sanitation entered the English language in the 19th century, and the term is linked with the integrated water and sewer system. Sanitation is the hygienic means of promoting sustainable health through prevention of human contact with the hazards of waste. The hazard of waste can be physical, microbial, biological, or chemical agents of disease. The waste that can cause health problems can be human or animal feces, solid waste, domestic wastewater, industrial waste, and agricultural waste. Sanitation is essentially a basic as well as long-standing public health issue. When early people settled in communities and started to cultivate crops and raise animals, sanitation became the primary concern for the society. Term sanitation can be applied to specific aspect, concept, location, or strategy. So, basic sanitation refers to management of human feces at the household level. On-site sanitation is the collection and treatment of waste where it is deposited. Examples could be pit latrines and septic tanks. Food sanitation refers to the hygienic measures for ensuring food safety. Environmental sanitation is the control of environmental factors such as pollution that form links in the disease transmission. Ecological sanitation is a concept and an approach of recycling to nature and nutrients from human and animal waste. According to World Health Organization, sanitation refers to provision of facilities and services for the safe disposal of human and animal waste, for improving and protecting public and environmental health. Sanitation also refers to the maintenance of hygienic conditions through services such as garbage collection and wastewater disposal. Inadequate sanitation is the major cause of disease worldwide, and improving sanitation is known to have significant beneficial impact on environment and public health, both in the household and across the communities. According to Joint Monitoring Program for Water Supply and Sanitation by WHO and UNICEF, an improved sanitation facility is that in which hygienically separates excreta from human contact, and it is used only by the members of one household. Toilet flushing to the sewer system or septic tanks. Presence of ventilated improved pit. Pit latrines with a slab and composting toilets. So basically, joint monitoring program indicators, they monitor the progress of the improved source of drinking water versus the unimproved sources of drinking water. The improved sources of drinking water can be piped water into dwelling, piped water into yard, public tap or standpipe, tube well, bore well, protected dung well, protected spring well, and rainwater. On contrary, the unimproved source of drinking water can be unprotected spring, unprotected dung well, cart with the small drums, surface water or bottled water. On the other hand, the improved sanitation will be a flush toilet, piped sewer system, septic tank, pit latrines, ventilated improved pit latrines with a slab and composting toilets. On the other hand, unimproved sanitation can be a pit latrine without a slab, bucket, hanging toilet, shared sanitation, no facilities, or in a bush or a field. Let us understand a relation between water, sanitation, and health. Sanitation has a direct influence on environmental and public health and has an indirect influence on sustainable development. Despite the increased coverage of drinking water supply and sanitation services across the country, there still exist major limitations in terms of coverage, quality, and equity of the service delivery. These limitations primarily affect the inhabitants of rural area, small urban centers, poor and marginalized peoples by burdening them with the disease and reducing their capacity and chances for a long and healthy life. Water related improvements are crucial to meet the development goals. It will reduce the child mortality and improve the health in a sustainable way. There is a reciprocal relation between the sanitation, public health, and sustainable socio-economic development. Socio-economic development tends to improve the sanitation and public health, while good health and sanitation contributes to the socio-economic development. But economic development alone cannot reduce the mortality and morbidity. So, special programs in nutrition, healthcare, and environmental sanitations are needed to supplement such practices. Poor sanitation, improper hygiene, and sewage disposal facilities, and inadequate water supply, they all are related to transmission of many infectious diseases, including cholera, typhoid, hepatitis, polio, and ascariasis. Other water related and water wash disease related to poor sanitation and hygiene are dysentery, trichoma, schistosomiasis, conjunctivitis, hookworm disease, Japanese encephalitis. They are some of the additional burden of disease on already vulnerable group. Another type of environmental sanitation program arise from housing with insufficient space, ventilation and access to sunlight, This can lead to spread of airborne disease like tuberculosis. Improper sanitation also involve considerable economic risk in terms of increased household expenditure for treating the waterborne and water related diseases as well as loss of work days. Such expenditure could be largely avoidable, adding to impoverishment of already poor community. So, various kind of environmental, health, economic risk, they exist cumulatively. Many of these risks, particularly disease infections, can be reduced or overcome through good personal hygienes like washing hands, bathing, wearing clean clothes, and proper sanitation, using clean and safe toilet, keeping the water sources clean, and disposal of garbage safely. Health hazard of improper sanitation can be divided into four parts: soil pollution, water pollution, contamination of food, and propagation of vector diseases. Epidemiology has become a necessity in the field of healthcare for effective disease prevention and control. As a science, it utilizes a rational study method in identifying distribution pattern and determinants of disease, and it can predict the disease pattern and plan for its prevention and control. All these hazards can implement social community in form of various communicable and non-communicable disease. Communicable disease are also known as infectious disease. They are result of causative organism and spread from one person to another or from animal to people. There could be various modes of communication of germs. It can be either by contaminated air, water, food, soil, direct and indirect contact, as well as disease carrying vectors. The germs can multiply under favorable condition and upset the normal functioning of body, thus producing the symptoms of disease. Such disease are very common in infants and children, and most of these diseases are preventable by simple measures. Let us understand types of communicable disease. The first one is contact disease, such as scabies, fungal skin infections, trachoma, and acute bacterial conjunctivitis. Second one is sexually transmitted disease, such as HIV or AIDS. Third one is vector-borne diseases like relapsing fever, yellow fever, trypanosomiasis, plague, leishmaniasis, and malaria. The fourth one is the disease caused by fecal, oral contaminations like acute gastroenteritis, bacillary dysentery, Campylobacter jejuni, giardiasis, amoebiasis, cholera, enteric fevers, food poisoning, polio, and viral hepatitis. These are the disease caused by the fecal. The fifth one is helminthic disease like ascariasis, enterobiasis, hookworm, tapeworm. The sixth one is airborne disease like acute respiratory infections, tuberculosis, and leprosy. The seventh one is zoonotic disease, that is the disease of contact with animals or animal products like anthrax or rabies. Non-communicable disease are the disease which are not caused by the living organism and do not spread from one person to another. They are therefore called non-communicable disease. Such disease can be cardiovascular disease, coronary heart diseases, hypertension, cancer, diabetes, obesity, blindness, malnutrition, accidents. These diseases have multiple causes and tend to develop slowly and progressing over times. Sanitation measures for disease prevention and control. Sanitation is primary barrier for preventing entry of many harmful human pathogen into environment and avoiding its contact. Improper environmental sanitation, that is the unsafe water, polluted soil, unhygienic disposal of human excreta and refuse, poor housing, insect and rodents, they are principal cause of ill health and spread of infectious disease in India. In order to control them, it is necessary to take various sanitation measures and control vectors. For example, malaria control can be done through reduction in draining the swamps and marshes and spraying of insecticide and using the anti-malarial drugs. The sanitation measures could be adopting preventive measures for sanitation, providing systematic repair and maintenance of sewer and drains, investment in better solid waste management, expanding the existing wastewater collection to serve all the areas, upgrading and constructing sewage treatment plants, providing appropriate sanitation wherever sewerage is not practical, urban planning to manage peak flood water flow. There could be interventions to promote personal and domestic hygiene, and these are effective in reducing disease, like boiling water before drinking or using water purifier, washing hands with the soap after de-defecation, handling babies' feces before feeding and eating or before preparing the food meals. So proper hand washing with the soap can prevent many diseases. Let us understand about healthcare services. Health is a fundamental human right and it is a state of responsibility to provide healthcare facilities to all of its population. The purpose of healthcare services is to improve health status of population, reduce the mortality and morbidity, increase the life expectation, increase in nutritional status, provision of basic sanitation, health manpower requirements, and resource development. Ideally, healthcare services should be comprehensive, accessible, acceptable, provide scope for community participation, and should be available at an affordable cost. There are current criticism against the healthcare services is that they are predominantly urban oriented or they are mostly curative in nature and accessible mainly to a small part of the population. The utilization of curative as well as preventive Healthcare services allows an individual to improve personal health status. Sustainable development goal demands new way of thinking about the health system. Good health depends on social determinants of health like education, wealth, employment, social protections, cross-sectoral public health actions, and improved food, water, road, occupational safety regulations. WHO definition of health system consists of all organization, people, action whose primary intent is to promote, restore or maintain health. And access to high quality healthcare is human right and moral imperative for every country. Healthcare system at the three levels: primary care levels, secondary care levels, and tertiary care levels. In primary levels, we have two types, that is sub-centers and primary healthcare. At secondary level, we have community health center, and at tertiary levels, we have hospitals and medical colleges. Sub-centers, primary health centers and community health center. All of these are regulated by the central and respective state government. Besides this, we have an indigenous system of medicine which is recognized by Government of India, Ministry of Ayush, which are dealing with the Ayurveda, Siddha, Unani, naturopathy, homeopathy and Sowa Rigpa type of medical system. We also have voluntary health agencies and national health programs. India's health sector is highly complex and consists of overburdened public sector and unregulated private health sector. So, the National Health Policy of 2017 was developed to reach everyone in a comprehensive and integrated way to move towards wellness. The objective of this policy is to achieve highest possible level of good health and well-being through a preventive and promotive healthcare orientation in all the development policies, and to achieve universal access of good quality healthcare services without anyone to face hardship as a consequence. Universal health coverage is the starting point for improving the quality of health system. Improving quality should be a core component for this initiative, along with the expanding coverage and financial protection. Under this policy, in India, we have Ayushman Bharat, a flagship program which is a road to universal healthcare with the mandate to ensure universal, accessible, equitable, and affordable healthcare for all and everyone. At population level, we have elimination of disease and promoting wellness. Ayushman Bharat is attempt to move from a selective approach to deliver a comprehensive range of services spanning preventive, promotive, curative, rehabilitative and palliative care. It has two major components which are complementary to each other. The first one is Ayushman Bharat, under which 1,50,000 health and wellness centers are created to deliver a comprehensive primary health care, which is universal and free to user, with the focus on wellness and delivery of expanded range of services close to the community. The second component is Pradhan Mantri Jan Arogya Yojana, which provides health insurance cover of rupees 5 lakh per year to over 10 crores of poor and vulnerable families for seeking secondary and tertiary care. These centers deliver a range of comprehensive healthcare services like maternal and child health, services for communicable and non-communicable disease, and also services for elderly and palliative care. These wellness centers provide essential medicine at free of cost. They have diagnostic services, teleconsultation, and health promotion through wellness activities like yoga. Since its inception to September 2021, we have around 77,784 health and wellness care developed centers so far. Very recently in September 2021, Pradhan Mantri, the PM launched Ayushman Bharat Digital Mission. This mission connects the digital health solution of hospitals across the country. The digital ecosystem will enable the host of all the facilities like digital consultation, consent of patients for a medical practitioner to access their records. These all will be digitized under the Ayushman Bharat Digital Mission. So, in this session, we have learned about water, sanitation, hygiene for achieving the universal health coverage. Thank you and happy learning to all.